older Chow Chow who has a history of severe arthritis in the elbows, but it's had really acute progression of its forelimb lameness for an unknown reason. And so it did splay out and fall on the tiles in the house. And so we think it ruptured its medial glenohumeral ligament. And so on physical examination, it definitely did have increased angle of abduction of the medial glenohumeral ligament and a lot of pain and stuff like that. So we're scoping the joint, and then we're going to do a medial ligament replacement. I'm just trying to find the joint right now. There it is. That must have gotten tapped. So I'll just move the camera back here. Okay. So I've got the first needle in the joint. What we'll do is we'll inflate that. Go ahead and inflate that, please. I'm going to put another one in the biceps bursa here. Go ahead and lots of pressure. Okay, so then I can pop this in the front here. So now we've got one in the biceps bursa. And then we'll put pressure on that. Okay, so that's coming out there. And then I'm going to take a blade right along that needle. And I'll take my trocar and drop it in along that same path. So now I'm in the joint. We can confirm that because when I remove this and flush, we should get saline coming out through the, has that popped out? Give it a little flush and see if it comes out the top. No, okay, that's all right. All right, so then I will put our camera or telescope into the joint here. And then I need the light source turned on. That's on. Okay, and then we'll disconnect the needle here. And then we'll have the surgery. These lights turned off, please. I should be up against the medial joint capsule here. Turn on some pressure. All right, so that is all shredded medial glenohumeral ligament right there. So I'll come back out a little bit. So that is just completely trashed medial glenohumeral ligament. That's the glenoid up there. All right, so now we'll go up and look. That's the biceps tendon right there, which looks great. There's our needle. That's our egress needle right there. Okay, so that's our biceps tendon. That's the glenoid, or the glenoid, or the humeral head is right there. So we're looking around the back there. Are you sure this is on arthroscopy, on the telescope? Let's see here. Look down. There might be something that we can do, but that's all right. I can see what I need to see. All right, so looking around the back here, and this is where we would see an OCD lesion, but this dog is too old for OCD anyway. So we can see a lot of synovial proliferation up there, and then just a completely shredded medial glenohumeral ligament up there. That's the ligament. That's one of the bands of the ligament right there. And then that's all subscapularis tendon, and it is just completely trashed. And again, confirming that our biceps tendon looking cranially is intact. Can you see that, Marnie? Do you want to see the, so that's biceps tendon up there, looking beautiful. That's subscapularis tendon right there, looking shredded. And that's ligament all looking shredded as well, right there. So that's the exploratory part of the procedure. We can turn off the saline.
Yep.
All right, and we can turn on the surgery lights. We'll get rid of all the scope stuff. And then you can put it on the big screen. Yep, perfect. How'd you like that little fade transition? I love my toys.
Very cinematic.
All right, and then we'll disconnect. So we turn off the light, that's all done. Hand off the telescope. Now, some people will do the ligament replacement actually through the scope, but we don't do that. I just have a technique that I think I can get better isometric points, and so that's what I use. All right, so now we're going to make an incision on the leg. So I'm going to go along the scapular spine here and along the humerus here, just to get enough exposure so I can get my sutures where I need them. Get a little cautery. Sometimes there's so much fluid extravasated that the cautery doesn't work very well. So you can see all that extravasated fluid there. So it'll take us a little while to get through all of that. I get cautery turned up 45, please.
Yes, it is on 45.
Are you sure we've got good contact with the ground plate?
I can have a fiddle.
Thank you. So that's all kind of sub-Q fluid from the scope procedure.
I might be a bit better.
Thank you. Let's get some Gelpies in here, please. Another Gelpie, please. Another set of Gelpies, please.
Small.
Same size, please. See what you got. Yep. So it's a bit of a trick doing a medial ligament repair from a lateral approach, and that's something that we worked out when I was at Southpaws, how we can do a medial ligament replacement from a totally lateral approach. So this muscle here is the ulnar transversalis. Are there any other settings on the cautery that could be not what we're used to? Like, is it on blend or?
Is that better?
It's not great.
It's on blend.
Turn it up to 60.
He's really fluffy. So
Yeah. So we might have to just really soak the fur, like get a whole bottle of saline and pour it on him. Yeah. So I'm trying to cut down that ulnar transversalis from the scapular spine so that I can reflect the supraspinatus muscle cranially and get a really good look at that little fossa, or that little groove. Happy?
Yep, so yeah, almost where.
That is so much better. I reckon we can turn the cautery back down to
Yep, 45.
45, yeah. So this is a chow chow, and so the fur was really fluffy. So that's getting into supraspinatus up here. And I need to expose almost the biceps bursa of the humerus. Can you please or cut the tape on the leg? I've got the leg distracted distally so that it really opens up that joint, makes it easier to get the scope in, but it really restricts the movement of the leg when we're trying to manipulate it for the surgery. So, did I get my right angle forceps?
Yeah.
Can I get my cerclage kit, please?
Sure.
I'll need my buttons and my Liga fiber.
There's the class kits here.
Just try to move that forward a little bit and zoom in. Okay. I'll move my light source a little bit more into here. Right, so now we have to watch out for the suprascapular nerve. Just going to be sitting right there. I can see it. So I need to do a little prep over here. And do we have our buttons? Sorry. Yep. So I'm just prepping my little double-ended cerclage wire. So I'm creating kind of a double-ended, almost like a sewing needle. So now I've got a double-ended kind of sewing needle here. I'll take my Liga fiber. Where did that go? So Liga fiber is braided polyester. Super strong, lasts a really long, lasts forever. So now I'm going to pass it through one of my buttons. I'm going to have to be careful when I put that button in that I'm not entrapping the suprascapular nerve. Okay, so we'll cut the other needle off. Then I will pass my suture through my double-ended needle that I created, cerclage wire. Can you put our drill bit on, please? And then I'm going to clip my ligafiber with hemostat so I don't accidentally pull it all the way through, which is really annoying. And all these little hints that I give you guys, it's because I've screwed it up in the past and have come up with a solution to keep myself from doing it again. You know what? I think I'm going to need a bigger Homan.
Yeah.
Thank you. Can I get a Kern bolt holding forceps? So we'll put that underneath the supraspinatus, down there. So I'm looking right next to right where my suprascapular nerve is, right down there. And grab onto the acromion. Or not. Let's lift that up a little bit. Okay. Now I'm going to drill through here, right up next to the scapular spine. Hope my head's not in the way. So now, can we get suction on, please? So my hole is down there. I don't know if you guys can see that hole, but I've got a hole just cranial. Hold on to that, please. Just cranial to my scapular spine. Pass my needle through the hole, and then I'm going to reach around the front with a right angle forceps. I'm looking for a right angle forceps. There it is. I'm going to reach around and try to grab that cerclage wire. Get it? I did get it. Maybe not. Can I get you to lift up on that, please? I'll get you to do the suction, please. Cover the hole, please, with the suction. Cover the hole in the suction tip. This is the hardest part of the surgery, I reckon. So I got that through. And then pull this around like this. Let's pull that out, please. And then we'll put that back in, please. Okay, so now when I pull this through, I need to make sure that the button is not entrapping the suprascapular nerve. So I've got it well underneath. Okay, so we can release that. Remove that, please. All right, so now I've got this medial to the scapula. So now I'll just grab this with a hemostat. Hold on to that, please. Now I need to get underneath the pectoral muscle and get it medial to the humerus. Past this right angle. And this being one of the bigger dogs we've done, makes it a bit tricky. Okay, so then release that plate. I need both strands in the, yeah, thank you. All the way in? Yeah. Okay, so now I've got that around the pectoral muscle here. And then the next thing we have to do is drill through the humerus and re-grab our suture. I'm just trying to decide whether I'm going to, let me just make sure I don't have a lot of soft tissue entrapped. Now that feels pretty good. Okay, so you can release that, please. Then I need to reflect vastus caudally. So this is the proximal humerus here. So let's get our Homan, please. Just put that around the back of the humerus. And then the place that we need to drill is in the insertion of the teres minor which is right there. Let me just see if I can pack a bit more in here. Alright, so that's the teres minor right there. So that's where our drill hole has to go, and I have to decide whether I'm going to get a bigger. Can I get a 20? This was 21?
It's 22.
Can I get 21, please? Because this one is more of a direct shot. And this one we don't need that double little twist. Arthrex makes some little suture loops that you can use as well.
21.
Yep, thank you. And the surgery always seems like such a good idea coming into it, and then I find it often quite frustrating because I can't get the sutures to pass where I... It's like when you decide to paint a room in your house and you're like, it's going to look awesome. Such a good idea. And then about an hour into it, you're thinking, this really sucks. I can't believe I started doing this. Let's put a little twist on the back here. So I'm creating a new cerclage wire loop to grasp that suture on the medial side of the humerus. Hopefully it'll go through the tiny hole in the humerus that we're going to drill. Alright, so now we have to go through the insertion of the teres minor. I have to be careful not to go too far, because I don't want to pick off any of the brachial plexus. Alright, so now what I'm going to do here is grab onto the drill bit. With my right angle forceps. Okay, so that's in the drill bit there. So now what we're going to do, you can release that please. You're going to grab onto that piece of cerclage wire that I just cut, and I'm going to open this up. I'm going to pull the drill bit out, and you're going to introduce that through the same hole. And go more vertical. And that's farther proximal. Yep. Keep going. Let me just see if it feels like it's in the right place. Yeah, it does. Can you grab the Homan, please? I know that that went through, but I'm going to re-drill that just to be sure. So that's gone through there. I am going to grab that with a forceps just to make sure that I don't accidentally make sure that I've got that there. I do. Pulled it back too far and it's come out. Let's hold. Let me get a thumb. Oh, I'll just grab this guy. That's all right. Probably should not be the first orthopedic surgery you try in general practice.
Yeah, exactly.
It's a kind of a fiddly one. Where is... through now. See it here. Can I grab okay, got it. Alright, so now we pass that around there and then we need to open it up enough to get the suture through. Okay, and then I'm going to grab thumb forceps. I'm just trying to feed both ends into the thumb forceps, please. Push it down, push one finger down deep to it. Okay, is that both of them? Okay, so we pull that through there, and then I just grab my wire twister and pull this up like that, and now we've got both ends through the hole.
In like that.
So I'm going to make sure I haven't picked off any nerves. I'm worried that we may have something entrapped in there, just given the response that we're getting. Can I get a large speed lock bone clamp, please?
Sure.
going to try to lift up the humerus and see if I can see any nerve roots or anything that might be entrapped. Not sure if this will work, but lift that up and get it Gelpy, please. You can take out that Homan. Lift that up for me, please. So I need to try to get that out. Can I get another Gelpy, please? Do we have one here still? Suture there. Release that, please. Okay, so just having a look medially to see if there's anything obvious in here that I might have entrapped with my suture. The reason why I'm doing this is because he really reacted when I pulled that suture tight. So I think we'll try again. Where's my cerclage wire? Is that the big one?
Yes, sir.
Yeah, thank you. Alright, so we'll pass it through that same hole. Sorry, let me just get this a little bit farther behind. Get a needle. Relax that a little bit so we can get reoriented. Okay. Where's my suture? Alright, so now we'll drop that back through. I'm going to see if I can actually see where this is coming through. You can feel it underneath there, but it's kind of folding itself around. It just keeps folding under some soft tissue. doing that. You all right? Testing your muscles? You're okay?
Yes.
Okay, so I can feel it. Okay. So try again. Alright, so we can relax everything. Just keep that common in there, I think. Take this out. Through. Any reaction on the front?
No.
I must have had that little nerve root. Okay, so now where's our button? So then we feed our sutures. I'm probably going to have to cut. Can you just give me some tension there? It's good for you to see, those of you that are watching, that not all surgeries go perfectly every time. Great, thank you. And I'll get a couple of needle drivers to tie the knot. Can you get our dose of bupivacaine, please? Not reacting. And again, this fiber wire you have to cut with a blade. You can't cut it with scissors. We doing all right up front?
Yeah, everything's good. 9.4 is our total dose.
Okay. All right, so then we'll just let that cover up there. I've got a needle already.
Perfect.
Release these guys, and so then we'll just inject Marcan into all the muscles that we cut. Get some 2O PDS, please.
Sure.
I think we've moved the camera. Can you move the camera back, please? And get the table up some more, please. Thank you. And then just try to reposition the camera just by pushing the boom arm out of the way. Yep.
Happy?
Yep. Alright, so first thing we're going to do is close the ulnar transversalis back across.
Would you like me to give the next dose of antibiotics?
Yes, please. Alright, and Jacob, I'll leave this to you, so just continue your sub-Q down there, and then do like a superficial sub-Q and then intradermal. Okay, so just come over there, make sure there aren't any questions that I've missed. This is a bit trickier surgery than it normally is. So if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we will talk to you again soon. Hi Seoul, hi Egypt, hi Brunei.